Hey, it's Eric Beard. Hope you guys are having a great day or night whenever you're watching this. Sorry about the buzzing. It's just my DMS, my deep muscle stimulator. I'm on the road right now in Connecticut to teach a workshop for NASM, and because I get to drive down here instead of fly, I figured I'd bring my DMS. I'm doing a little soft tissue work on myself before I do some stretching in my corrective work and a little workout tonight. Just a short reminder, I know when it's beautiful outside, it's summer and we get busy, it's easy to blow off the stretching and core stability work and all that stuff that keeps us moving. Just a reminder, take care of yourself even when it's beautiful out, to keep yourself healthy. It's a good model for your patients, clients, and athletes that they take care of themselves too, and they can always stay pain-free and do the things that they love to do. So after some good DMS to my TFL quads and adductors, like to do some nice static stretching for the hip flexors. So you can just kind of do the static kneeling hip flexor, which is fine. If I can find some objects like this to help position myself, I'll actually try a subtle variation of this, where I'll keep my pelvis neutral or in a slight posterior pelvic tilt, engage my abdominals, but I'll lean forward here. So I'm not going into necessarily excessive hip extension on the back side. I'm really going through dorsiflexion on the front side. So I might get a little bit of an active stretch on the front side angle if I activate my tibia anterior. I get some hip flexion on the front side, maybe getting a stretch on my adductor magnus on the right side and hip extensors. But what I'm trying to do in the back side is abdominals are engaged and I'm controlling myself. I'm taking some of the weight of my upper body into my arms and I'm passively bringing my femur into extension, or at least holding neutral, depending on how tight you are. This can keep someone from arching their low back, from staying neutral. It also, when people try to squeeze their glutes, many times they get their piriformis to fire, they get synergistic dominance there. So this is a nice static stretch for a little bit more of the psoas. My knee is extending, so rectus femoris isn't firing or getting lengthened all that much. But I can go from here, from this static stretch, to more of an active stretch where I'm engaging my abdominals, engaging my glute, and then I'm leaning into the stretch a little bit more. So I'm staying neutral through the lumbar spine. I'm getting close to neutral or 0 degrees of hip extension. And then if I can stay neutral in the spine and come up, what I'm doing is I'm bringing this hip into further hip extension, or again, getting back to neutral if you're pretty tight. So as you go down into this, the abdominals are engaged. You're going down passively, keeping neutral. And then if you want to engage the glute through here, it becomes a bit more active, and you could hold that in one position or come out of it, lean back in, engage for 2 to 4 seconds. Come back out, abs in, squeeze the glute. Now, if I'm going to make this more active, I might want to come up into dorsiflexion. That way I can actually push through that first MTP joint, the first big toe, abs in, glutes engaged. Get a little bit more of an integrated movement, almost like a lunge movement. And then eventually you could actually take this into a lunge movement or some sort of squat to get some sort of integration. So remember to take care of yourself, do your soft tissue work, do your static stretching, and try that variation of the kneeling hip flexor, which is a little bit more for the psoas. Just make sure the lumbar spine stays neutral. I'm Eric Beard. Hope you're having a great